Today, we're going to discuss integrative therapies in the veterinary world, just the concept of using low-dose naltrexone for your furry family members. We're going to explore the uses of low-dose naltrexone in the veterinary clinical practice, and we're going to even touch on a few specifics around the cancer population, including using low-dose naltrexone with chemotherapy in your pets and using low-dose naltrexone in other situations for animal care. And then we're going to spend the majority of our time discussing a few case studies, which will make this come to light. And so our purpose of discussion today is to expose you to some other applications that you may not yet realize in the animal world. And so low-dose naltrexone for pets. But when I asked if LDN would work for certain conditions, or whenever asked if LDN would work in certain conditions, I had the absolute pleasure of meeting and learning from, when he was still on this planet, Dr. Bahari. And he would basically say in every situation that was asked, give it a try. What's the harm? Speaking to some of my colleagues who practice integrative veterinary medicine, they agree that they have seen low-dose naltrexone prescriptions for animals, mostly dogs and cats, but there's no reason to even exclude other animal forms who might be suffering from chronic conditions. And naltrexone specifically is an opioid receptor antagonist that is used in veterinary medicine to block receptors as a reversal agent for opiate agonists such as butorphanol. So it's also used in the treatment of recurring compulsive animal behavior disorders such as tail chasing and self-mutilation such as acral lick dermatitis. And it's also currently under study for possible application in a wide range of therapeutic areas within veterinary medicine, such as treating lymphoma, adenomas, nasal and sinus cancers, inflammatory bowel disease, and degenerative myelopathy. Studies, the first things I talked about were more in relation to its normal dosing, but the current studies underway are definitely more about the low dosing, and we'll talk more about that in a moment. But the time for administration for a full dose naltrexone to take full effect in its recovery from, as a reversal agent is somewhere between 1 and 2 hours, though I'm going to give you a very interesting case study that saw a reversal much quicker than that. My story of one of the cases we're going to share is my success of using low-dose naltrexone led me to trying it in my own furry pets. And so this is where a lot of these things start. The pet owner decides, hey, if it worked for me, maybe it'll work for my little one. So due to the favorable outcomes, veterinarians are now prescribing low-dose naltrexone for their patients. It has huge application in how it can be used in the veterinary world. The bottom line here is that low-dose naltrexone is proving to be an effective therapy for treating your pet in general. Care tenderly for all pets throughout their precious lives. The interspecies dance of love softens and expands the heart.